Dr. Raajasiri Iyengar. She has got an scientist position. She is a scientist in Indian Council of Medical Research from Bangalore, and she has done a master's in public health and a distinction from University of Dundee, Scotland. That's really great. And she has got an academic background which includes the undergraduation in dentistry, and she is even awarded with a gold medal in the pediatric dentistry. That sounds really great.
Yeah.
So I just want Rajeshri to take over, and we are waiting for her speech.
Yes. Hi everybody. Am I audible and visible to everyone?
Yes.
Okay, perfect. At the outset, I'd like to thank Thelma for that very thoughtful presentation.
Thank you.
I've been caring for my grandmom, and I saw so much of that in your presentation. So if these products were here in India, it would have made a difference to so many. So thank you for that thoughtful gesture.
You're very welcome.
Okay, and thank you to the organizers at Helix for having me today. I'd like to begin by saying that in my presentation today, I will not be representing any of the organizations that I'm affiliated with. This is rather, it's like a scientific dialogue for me with the global community in my personal capacity. So yes, thank you for that wonderful introduction as well.
Yeah, that sounds really great, and we are going to present your slides, and you can just go ahead with the presentation. We are going to assist you with that.
Yeah, perfect. Thank you so much.
Yeah.
Yes, there it is. Thank you. So what I'm going to talk about today is a very pressing issue across the world, which is genetic disorders. I'd like to begin with a quote from Sam, a writer from America, who says that genes are like the story and DNA is the language in which the stories are written. So we'll discuss more about DNA, the genetic disorders, the prevalence across the globe, and in India as well, from where I belong, and thereafter look at some ethical consideration. At the moment, I'm working in the area of ethics. As mentioned in my introduction, I have a background in dentistry for my undergraduation and public health thereafter from Scotland for my master's, where I worked with some homeless people in Edinburgh for the Smile for Life program. And at the moment, I'm working in bioethics. So I would also discuss some ethical aspects in this presentation. So can we please go ahead to the next slide? So over the next 30 minutes, we'll be discussing and going over genetic disorders, an overview of genetic testing, some ethical considerations, like I mentioned, something very important, communication with the participants through genetic counseling, social implications of genetic research, some future directions, and finally the conclusion. Can we go to the next slide, please? So like I quoted earlier, genetic disorders stem from DNA, deoxyribonucleic acid, and its abnormalities, which could lead to diverse health issues. The issue with genetic disorders are that they can pass through families because they're inherited or result from new mutations, which directly may impact the bodily functions. Millions of people are affected globally, and there is a significant healthcare burden due to genetic disorders across the globe. Now, ethical considerations are extremely important in these genetic disorders and the research associated with them, as we will see in the forthcoming slides. There is a strong need for public awareness of these disorders. There are a lot of patient advocacy groups and patient representatives that I meet often who are really trying hard and trying their best to spread awareness about different types of genetic disorders because they really impact the quality of life and productivity. So let us please move on to the next slide. Here's a study from 2004 which presents the minimum global estimates of the birth prevalence of genetically determined congenital disorders, but this is categorized by economic levels. So if you look at the graphs, you can clearly observe a trend. So the total burden is at least 20% higher in the low resource countries. So if you could see the low income countries, that's the highest bar. So it's at least 20% higher when compared to the high resource countries. So there's a clear economic disparity here. So this data is actually from a study by Christensen Arnold. Although it's a really old study, 2004, I think we've still got a lot of opportunity to improve and reduce this health gap. Let's move on to the next slide, please. So, given that economic disparity, let's now look at the global prevalence. I've put a slide for rare diseases because the statistics are staggering. There are approximately 300 million people across the globe who are living with rare diseases. And around 80% of these rare diseases have a genetic cause. And 70% of these present in childhood, which means the quality of life is very strongly impacted for people with genetic disorders. And 95% of these rare diseases do not have approved treatments. For a person to get an accurate diagnosis that they have a genetic disorder, the time period is just staggering. It could take about 5 years nearly for a person to even know that they have a genetic disorder, which is rare. And 30% of the children with these rare diseases unfortunately meet their death before they even turn 5. So this is an area that really has to get prioritized when we are setting our priorities for research. Can we go to the next slide, please? So we did see the global prevalence of rare diseases, but when it comes to India, the records are staggering because across the world, across Europe, UK, America, Africa, when we compare the highest number of prevalence, the highest prevalence of rare diseases is in India. It's 72 million people that are affected by rare diseases. And in the ICMR registry, as of September 2024, there are 14,000 cases registered in the rare disease registry, but I'm sure there are much more that the registry has to count for. So this is an area that really requires awareness, prioritization, and scrutiny and engagement from researchers, from patients and public advocates, representatives, and all of us around the world. So let's go on to the next slide, please. Now let's move to genetic testing. Like I said, it could really take nearly 5 years for these rare diseases to be diagnosed. So, and these have to be diagnosed through genetic tests most of the time. So let's see what genetic testing is. So there's 3 types here: diagnostic, carrier, and predictive testing. The benefits of genetic testing is that it could facilitate early diagnosis, precision medicine and personalized treatment, and of course prevention strategies for members who could be affected in the family later. So potential risks of genetic testing are of great ethical concern because it not just affects the person themselves, but there could be implications for the immediate family, friends, and relatives. So there could be anxiety from results, like I said, implications for family, and a limited access based on economic status. These tests are generally not inexpensive. People have to burn a hole out of their pocket to really get it tested even. So that's the ground reality for many of these genetic diseases. Can we go to the next slide, please? So these genetic testing and screening would be able to reveal information about how likely an individual or members of his family are to be carriers of genetic defects. So a carrier is a person who has a gene that could cause the disease, but does not have the disease himself. So this person could carry this disease and transmit it to the children and grandchildren and so on, but they themselves are not affected by the disease. So you could find out if a person is a carrier, or you can predict if a person may get a disease in the future. So these genetic tests and screening tests are quite useful. There are some rules and exceptions here as to what kind of information of the results that we get out of genetic tests can be shared. So an individual's genetic data is very unique. It's like a fingerprint. There are techniques called DNA fingerprinting, because every person's DNA is unique. So an individual's genetic data cannot be shared with the family members without getting explicit consent from the person. So the person has to be fully informed that they are going to be tested, and the results shall be shared with his or her family or friends with a full consent from the concerned persons themselves. So without consent, the results really can't be shared even with the family, unless it is deemed necessary to help the person survive, or we're looking at ethical principles. If the person will be benefited by sharing the results, only then. But you most definitely require consent. So there is a strong need to counsel people, because a lot of them are not aware of what genetic diseases are, how they developed it, who are carriers, who can transmit the disease. So genetic counseling plays a very important part, and it's important to alleviate their anxiety as well. Now, like I was saying, the results could be disclosed only if the consent from the affected family member is obtained already, or it is required to save his life or prevent harm. And if consent is refused, the risks of non-disclosure versus a breach of confidentiality have to be weighed very carefully, and a decision is taken accordingly. So that was about genetic testing, counseling, and exceptions for consent. Can we go to the next slide, please? Thank you. This is much of what we already discussed, so I'm going to go through this quickly. We need the results to be communicated, especially more than harm. If there is a chance of benefits for the people by knowing the results, definitely should be communicated. Whether good or bad, the results should be communicated with the concerned person. And this should be specified clearly in the informed consent document. Now, informed consent document consists of two aspects. We've got the informed consent form, where the person's consent is obtained, and also it consists of a participant's information sheet, where this patient or participant is given full details of the study in a very comprehensible, simple, plain language, so that they can read through it, get to know, understand. And there must be provisions if they are illiterate, especially when we're considering the global south and the low and middle income countries. There has to be provisions for that, so that the patient or participant is actually fully informed before they consent for anything. So information is paramount, and the ethics committees generally work with researchers. For those among the audience who don't understand these terminologies, please hold tight and hang with me, as I will let you know. So ethics committees are actually like gatekeepers who look at research proposals to see whether this research is actually meaningful, will actually have a social impact, will really benefit the participants. So the ethics committees give their approval to researchers, even for the return of results when it comes to genetic testing. And like I said, DNA is very unique to every person. So identifiable information is invariably present when it comes to genetics. So samples should be anonymized or de-identified to protect the privacy and confidentiality of participants. But results cannot be returned from samples that have been irreversibly delinked from the personal identifiers or anonymized. So that's another concern. Can we go to the next slide, please? Now, ethical considerations are extremely important. I've already touched upon some of them: informed consent, privacy, and confidentiality. But what is ethics really? Ethics is about making a moral decision whether something is really benefiting people, society, and whether the benefits outweigh the risks. So in simple understanding, ethics can be thought of like this. We'll see some basics of ethics over the next few slides. Can I go to the next slide, please? So there are four basic principles of ethics, core ethical principles, which include autonomy, beneficence, non-maleficence, and justice. So autonomy is giving the rights and respecting patients and participants for who they are, ensuring that the individual's autonomy, ability to make their own decisions, is protected throughout the process of research or treatment, ensuring that these participants come to the research study voluntarily, and when they are vulnerable for exploitation, there are special safeguards to protect them, right? So all of this comes under autonomy, and informed consent as well. It should be fully informed before making an informed decision to participate in research or undergo treatment. Beneficence is that whatever we're trying to do as researchers, physicians, should be intending to maximize the potential benefits for individuals and society while striving to do good. And the same goes for non-maleficence. We want to minimize the potential harms and risks to the participants and patients. Justice is something that we're all really working hard on. Like I said, there is clear economic disparity, but we try and make sure that there is a fair distribution of benefits and burdens of research so that there could be equitable access and treatment for all. This is something that we're really trying to work on, and we can do it together. So can we go on to the next slide, please? Right. So nature of harms and risks have to be weighed. For if you're a researcher, or even if you're not a researcher but plan to do something that benefits people, it's important that we plan about what could be the risks, what could be the harms, what could be the benefits, and try and strategically make plans so that the benefits can outweigh the risks, and only then do we undertake any kind of research or study. So we have to weigh the social implications, see if the privacy and confidentiality is protected, think of future consequences, think of emerging technologies that could have an effect in the future, and how any issues that arise can be mitigated. The ethics committee as well. Now, ethics committees have diverse group of people, but they may not necessarily know or be experts in the area of your research or specialization. So ethics committees have a group of people who may not be experts, and they might need to sometimes co-opt or bring in subject matter experts so that they can really evaluate your research proposal correctly and fairly. So we must also think of a collaborative approach and safeguards for vulnerable population. There is another thing called therapeutic misconception. A lot of times, clinicians are also researchers. I've been a clinician researcher before, and now I'm a full-time researcher. So what happens is clinicians often have patients who enroll as research participants. So the patient of this clinician is now a research participant. The patient may not know that they're actually participating in research. They are still thinking that, oh, it's their doctor just giving them standard treatment.
Mm-hmm.
So that is called therapeutic misconception. We don't want people to be misinterpreting things or assuming that they are receiving standard treatment while they're actually part of research, right? So there has to be, that's why the informed consent is very, very important. And people must be fully informed of whether they're being administered treatment or whether they're being given, treatment as part of research, right? Can we please go to the next slide? Right. Written informed consent is essential because when things are documented, they are concrete. So consenting for screening and subsequent confirmatory test does not imply the consent to any specific treatment, termination of pregnancy. While what this point is trying to say is that if somebody has consented for a diagnostic test or screening, it does not mean that they've consented to undergo any specific treatment or things like termination of pregnancy for research. So informed consent is very clear, must be very clear in what it seeks. And if children are being involved in research, there's the concept of age-specific assent. And I'd be very happy to discuss this further on emails if any of you are interested. Can we go to the next slide, please? Now, when somebody is diagnosed with a genetic disorder, it's very, very important that they're not stigmatized, discriminated, and they themselves fully understand what's going on. So genetic counselors play a very important and key role in such cases. They're going to act as liaisons, provide guidance and support, and educate the patients. They also help people interpret results in the personal or familiar contexts, because genetic disorders could affect the family. Like I said, they could be hereditary. Now, counselors again must prioritize patient autonomy and decision making and be prepared to have difficult conversations. They also offer emotional and social support to patients and families who are coping with such test outcomes and risk discussions. So can we go to the next slide, please? So the genetic testing and research team, the role of the team is that they must create awareness, and this is a multidisciplinary team, and the team should consist of qualified lab personnel, physicians, counselors with formal qualifications, and specialists who deal with genetic disorders, who are trained in genetic counseling, are part of this team. It's essential so that people get the right information. Can we go to the next slide? Now, genetic research could influence public health policies, directing resources for prevention and screenings. There is a huge gap in access to genetic testing because many of these tests are quite expensive, and there is an economic divide here. But ethics always pushes for people centricity in research and equity. So as far as we can, we want to try that all individuals have access to genetic services and get unbiased care. So can we go to the next slide, please? Now, the thing with genetic research and tests is that there is a lot of scope for misuse. Mm-hmm. So there are regulations across the globe already, and some of which are in India as well. So because there's prevalence of female feticide in several parts of India. The prenatal sex determination and sex selection of the fetus is not allowed. HLA testing on embryos and fetuses is not allowed. Eugenic genetic engineering for the designer babies, where you could select the eye color, the hair color, the skin color of the child,
Yeah.
predetermine it, is actually raises a lot of ethical questions. Is it even okay? So that is not really allowed. Germline therapy in utero gene therapy is not allowed. Some of these terminologies are technical, and I would ask you all not to worry too much about it at this stage. So can we go to the next slide, please? So I come from the global south, and I'm sure a lot of fellow speakers and the audience would resonate with me when I say that low and middle income countries face quite a lot of challenges that are different from the high income countries. We have limited resources, infrastructure deficits, lack of trained professionals, especially when it comes to genetic testing. So this inherently makes people in the global south with low resources more vulnerable compared to those elsewhere. So making equitable access is critical. And it's only possible if we all work together for this as a global community. Additionally, we've also got some cultural beliefs and stigma, which will influence perceptions and responses to genetic testing. So we have to really be culturally sensitive when we're trying to deal with genetic disorders. Can I request the next slide, please? Now we've already got newer technologies. The future is here. So emerging technologies like CRISPR-Cas9 and artificial intelligence in genomics are raising newer ethical concerns. For example, AI, like who is accountable for the decisions that are made by artificial intelligence or recommendations? So there is no single person that could be held accountable, which is a big concern. And regulatory frameworks are needed to keep pace with such advancements so that we really protect people while we are also embracing innovation. Public engagement, education, and awareness is very, very, very important for informed citizenry and to advocate for ethical standards that align with the values of the global community. Can we go to the next slide, please? So that's the end of my presentation. It has spanned various areas: genetic counseling, ethics, genetic disorders, rare diseases. But what I really want to do here is actually to kind of begin a dialogue again among the scientific community to create awareness about these disorders. We want to understand genetic disorders, the testing, the ethical implications that they have. And this is to just rekindle an ongoing dialogue among all the stakeholders and champion ethical practices in genetic research testing. While we prioritize people's rights, people-centric research, and try and push for equitable access of genetic testing treatments and access to information for everyone. So that's about my presentation. Thank you all very much for listening to me patiently. My email is on your screen if you have any questions at all. So can you please go to the next slide that displays my email, please? Thank you very much once again, and I extend my thanks to the organizers once again for this wonderful opportunity. I really resonated with the presentations throughout the day, and I'm appreciative of the fact that women and areas that matter to women have been discussed today. I really appreciate that. So I'm also putting up my recent publication and my email in the chat for anybody that would like to read further or reach out to me. Thank you very much.
Yeah, that's really nice presentation, and you gave a very, very good insight about this genetic disorders and the testing methods and all. That's really nice, and presentation was really excellent and very informative. Thanks a lot. Thank you so much for the presentation. And since you provided your mail ID, definitely you'll be getting some queries. And if we
Sure.
get any, definitely we are going to share it with you. Thanks a lot. Thank you so
Perfect,
much
thank
for your presentation. Yeah, I expect a big round of applause from the people here. Thank you. Thank you so much.